All right, thanks very much. So the work that we do at U of T, we're really interested in developing safe and effective health and performance strategies for populations like that we're dealing with here today, but populations where often confronted with physically demanding, often unpredictable, and in many cases non-modifiable environments. And of course, our spectrum runs anywhere from professional to Olympic athletes, all the way to the work that we've done so far with firefighters and military personnel. So we haven't done work yet with paramedics, but we'd love to get involved, and I hope to spark some interest today, and I'll come back to that at the end. In these populations where it's a little bit difficult and not always possible to modify work, what we can find from the biomechanics literature, and there's evidence from the epidemiological literature as well, to some extent, that the way people move and the techniques that they use when they're doing things can really influence not only their injury potential, but also the potential for performance. So if you just think of it, if you're lifting a box and you hold the box close to your stomach versus sticking it out, extending your arms, you can tell that's a lot different demand in your low back. You can feel that. And that's the same general principle across the whole body. So what we want to do in our research more specifically is we try to ask questions about what are the factors that influence how people move in these environments. And then once we understand those factors, we look at retraining strategies to see, can we influence how people move in these unpredictable and chaotic environments. So the majority of our work, we spent literally probably 10 to 15 years analyzing and watching how people move and how they perform tasks. So I pulled a few screen captures from some videos. This is some work we've done with some firefighters. And what's really quite striking to us, is I'm sure it's easy to appreciate, is the variability in responses that people exhibit when they perform a very similar task. What I think was really surprising to us is that, one of those firefighters in particular has decades of training in body mechanics and lifting mechanics. And I don't want to get into too much with the time allotted today about, what the differences are between these, but it's really quite clear based on biomechanical evidence that what the back sees is quite different in each one of those exposures. And I think you could probably think about that if you were to adopt those techniques. And, this is something that really sparked interest in us a long time ago, thinking about, how is it? Why do people move it the way they do? So if we take a really big picture approach, we can summarize a lot of research, including the research that we've done, as this kind of just really simple diagram that says, the movement technique, or the way that the movement strategies people employ when they work, is really a combination of a whole bunch of interacting factors. Okay, so it really becomes conceiving movement as a behavior and then trying to modify behavior, same as we heard about just a few minutes ago. So definitely characteristics of the work environment and the work task performed are going to influence. So if you're lifting a low-lying object, you're going to have to get down there to get it. So that's definitely going to influence your movement solution. But how you do that is also dependent on the given performer's physical capacity. So where you bend and how you bend are going to depend on what your abilities are, okay? And the biggest thing we think that gets overlooked a bit, and we're going to talk about some specific examples of why this matters in a few minutes, but not only do we have these kind of really concrete, things like strength and endurance and, I got to lift versus a push or pull, but people's perception of the task, their experience, what they think they're capable of, all of those things, this all interacts together to influence how people move. Now, when we think about this, this makes assessment and retraining quite challenging to really identify these factors. So we've done a lot of work in this space, and I'm going to highlight just a couple of examples that may not have been a little bit intuitive to you, because you hear a lot of things about, back care, doing core strengthening and, endurance exercise. And that's definitely, we think there's evidence that that's a necessary piece, but we don't think that it's sufficient, especially for people like occupational athletes and athletes where, you're really faced with non-modifiable work and really quite physically demanding work. Okay, so just as one example, we were working with some firefighters doing some research a few years ago, and we were really quite interested. So this is actually a picture from our data collection, and you can see down this firefighter's on his right foot. He was unable to bend that foot, and we found out later, because it was really quite awkward how he was forced to lift. but he had an ankle fusion surgery. So all these efforts, to have him bend and maintain a straight back and all of these types of things are really difficult for him to do because he wasn't able to bend his ankle. Now, in this particular case, he was able to go up on his toe to be able to help get there. But once we increase the load and increase the load and increase the load, that solution becomes unavailable to him, and he has no choice but to bend somewhere, and it's usually, in this case, was through his back. So we thought this was quite interesting. So we actually did a small experimental study where we brought people into the lab. We added an ankle device to really lock their ankle to understand what the effect that might have on the back. From a big picture standpoint, the thing that was really interesting to us was that as that model that I demonstrated or put up a few minutes ago shows that the responses were really quite variable. So it really depended on an individual's habits and their behaviors and their capacity that would influence how they move. So just really quickly, I'm not sure if I have a mouse. Nope. What these graphs are showing is that on the left-hand side, we have one strategy where you can see without the brace condition, the person was able to bend all the way through the legs. But then you can see when we braced him, he was unable, that solution became unavailable to him. He really had to bend more towards through his back now. On the right-hand side, we see an individual who didn't look a lot different. He did actually implement the strategy that we saw with that firefighter where he kind of went up on his toes to be able to perform that lift. And we were able to determine later that this individual just didn't have a lot of ankle flexibility anyways, so that solution was never available to him. But the key point here is that the top two graphs in the middle show that how the loads were born on the low back are really influenced by the strategy that people use. So how people accommodate and compensate to different workplace tasks or their own physical capabilities are really quite individualized. So again, with a short amount of time today, I can't go into all of our assessment research, but this made us, this specific example through this lens, thinking much bigger picture about how do we help maintain health of the back and other joints as well, but is to really appreciate that movements of behavior. If we take that kind of idea, really understanding that it's really an interaction of the abilities of the individual, the characteristics of the individual, the tasks they perform, and the environment in which they perform it. All of those things are constantly working on an individual to basically guide and shape how they do things. Now, from the implication side, when we're trying to design assessment and retraining strategies, it really requires a multifaceted approach and a slightly wider lens. We feel, especially in these populations where the work is very unpredictable in many cases. So that's a big picture for us. I'm going to show you what I mean by multifaceted in a minute, because it might be a little bit different from a back care perspective than you've been exposed to. And related to this, that when we think really big picture about trying to design these type of strategies, is to think beyond just what the trunk is doing and what the spinal area is doing, but we need to think a little bit bigger picture and define and to be able to identify the factors that are basically causing issues in the low back. So let me talk a little bit now. So with that kind of a little bit of background, let me talk a little bit, from a big picture about retraining work techniques. So it's really common, to go all over the place and see all of these instructions and visual aids to help people lift. And in fact, there's some really good advice on these, but it's quite interesting when you look in the literature, there's not a lot of evidence that these use the right language or the right pictures to elicit the response that we want to elicit. So it's actually interesting. My colleague here, Dr. Dave Frost, that we worked really closely on together, he took this picture at a conference that he was at, which is really quite effective for today's talk. So if we look at these instructions, bend your knees, not your back. So this can be pretty good advice. But if we look at the guy there on the right-hand side with the yellow pants, he's certainly bending through his legs, okay? So he has lots of flexibility all the way and enough strength to do that, but his back is fully rounded when he's doing this, okay? So it's possible to lift with your legs, but really do it such that your back is still in a compromised position, okay? So we were kind of curious about that, about how do people really respond? So if you look in the human movement science literature, it's really quite predictable that if we change the words we use, people will change how they move. This is not even a contestable point. But we never really studied this in much depth. So we actually are just wrapping up a study right now. We just finished data collection This is a little bit busy, but what we did was we took different verbal instructions we gave, and these were kinesiology students. I'm going to come back to this in a second because this is important. But we gave these students these different instructions. One was just simply to lift, one was to lift with a straight back, and one was to lift with legs and not the back. And what I want you to take first point is that on average, what we have plotted here is the amount of spine bending that they exhibited when they lifted. And right away, you can see that just by changing the words, people exhibit more or less spine bending. And the direction that it went was that when we got further towards the technique, and especially towards focusing on the back, they bent less than they would have. Okay, so something like bend with the legs or lift with your legs may not be quite as effective as we hoped that it would be. And I did want to mention that this is kinesiology students because in our program, we teach these students and we are constantly teaching these principles, and even they respond to different types of techniques. And if we look at the actual magnitudes of these, so the actual values, some of these people were upwards of, based on the way we measured this, probably about 60 to 70% of their maximum bending capacity. These are students that we train. So this could be almost, the best case scenario to test it. And even those students are susceptible. So along those lines, if this poster really was a lot of work for us, or produced a lot of work for us, so we actually looked also at the pictures that are on posters. So we were kind of curious about when a naive observer, so not a kinesiology student or someone like you who's been exposed to body mechanics training, when they look at different pictures, how do they move their body? Are these pictures eliciting the response that we hope to elicit? And we're just wrapping up this study. Okay, data collection's finished, we're writing the paper. But what we did was we had, again, naive observers. So these were people who weren't kinesiology students, had no formal training in lifting or anything like that. It was a mix of students and general population respondents to our call. Basically what these graphs are showing really quite quickly here is you can definitely see first that there's a difference across these conditions. Now what we did for the pictures, I know they're going to be hard to see at the back, but all we did was we varied the amount of leg bending, so the amount of knee flexion versus the amount of rounding of the back. Okay, so we kind of had these different exposures, and what we hypothesized was that if you don't give people instructions and show them the picture, they can definitely model their lifting differently, than they may have without that instruction. But what we hypothesized is kind of exactly what came out, is that people were really influenced by the leg position more than the back position. Okay, so if we were just to put pictures up of people bending, I think it comes a lot from the way we teach lifting and we talk about lifting. So if we just put those pictures up without any very helpful instructions or effective instructions, we may not elicit the response. So on the top graph here, we have spine bending, so that's just the amount of bending that they did. And on the bottom graph, we were able to also use a little more sophisticated measurement device. We were also able to calculate the velocities of the spine, so how fast you're bending your spine. That tends to be a strong risk factor for low back pain and disorder reporting as well. So that was it's quite an interesting finding for us. And the reason that, I guess I'll summarize this first. We have about 5 or 6 studies going on right now in this space, just trying to figure out how people perceive things. And we're not even talking about their abilities yet. We're just kind of curious about how they perceive this. And there's a reason for this I'll highlight in a second. But if I were to summarize where we are at this point, was that if we're trying to change how people are bending their back, we should probably make our instructions more back focused. That seems kind of obvious, but it's actually interesting when you look across posters. They're often talking about the legs a lot, and we would argue that the legs is a feature of the lift that we can allow to adapt. So if people bend their knees more or less, that's great. They have lots of ability to do that, and we shouldn't necessarily constrain that. What we want to try to do is influence the spinal postures when people are lifting. The other part here is when we're doing that is just to be really explicit. So if we're using images, really try to highlight the point that we're trying to highlight. And many different posters and visual aids, if you look at this, they do this really well. So I wouldn't say that posters don't do this, but this is something we really need to think about. And I'm not even sure if even the way, I presented this just simple picture here, if this is even effective. We haven't studied this yet. And lastly, a lot of interest that we've had lately is that If you look on the bottom right-hand picture, it's been our observation, and now we have some data that's emerging for this as well, that people get confused about the difference between where your trunk is in space. So bending your trunk versus how your spine is curved. And you can see in that picture on the right, a lot of people without any training or a knowledge of spines and how they work would probably assume that that's not a really good lifting posture. And I would argue from a spine perspective, there's some evidence to say that your spine can handle that a little better than if it was rounded. But of course, if we think back a few minutes ago, that movement solution is only available to people who have enough range, in their hips and hamstring flexibility to be able to lift like that. Okay, so you can give this advice all you want, but if people don't have the physical capability to do it, they're not going to exhibit it. It's not possible. Okay, so why are we doing this work? Well, those are really interesting studies just because they're interesting. But a lot of this stems from the fact that, as I mentioned at the outset, we do a lot of work with firefighters. And to our surprise, and it's actually been, we've published this and so have other groups independently across North America, but exercise for firefighters on shift is actually quite a significant risk factor for musculoskeletal disorders. And it's actually really prevalent in the military as well. Now, we know that exercise, of course, has many benefits, and we think that this is one part of the job that we could actually have some influence on their exposures. So towards that end, one thing we're doing, I'll come back to some other things in a few minutes, but one thing that we're doing is we're creating these posters, and a lot of this support came from the CRE-MSD, doing the research to really help use the right pictures, use the right instructions and language to try to help people in an exercise environment to get the most out of it, to really actually realize those benefits before they potentially damage themselves doing it. So we have these posters hanging all over fire departments in North America at the moment, and we're still working on it, trying to find the right pictures. So that's really where this comes from. Now, from the movement retraining side, if we think about, well, does this stuff actually work? If you look in the literature, it's not overly positive about whether or not retraining works. But I'd actually argue if we take a real critical evaluation of that research, we don't know that the actual strategies we're trying to teach are even having the effect that we want to have. I will say, though, that when we have a relatively contrived work environment or training environment that looks a lot like the training environment that is, we can elicit changes. We can do this. There's evidence, we've done it. We can definitely make this happen. And there are parts of the job when you're afforded the flexibility that these training adaptations, they can transfer. Okay, and we've seen some pictures today. We watch people move all the time. So I've been watching every picture that came up, and you can see a lot of these things can transfer to that environment. But of course, that's not always the reality, and we need strategies that are able to transfer to these non-predictable and controllable environments. So towards that end, a lot of our current work, it's not going to play. So a lot of our current work here is looking at more advanced methods to really dial in the transfer of training. And for this, we're using a blend of many different approaches based on our understanding of human movement science. So just a few examples on this left-hand side. I'm up in the top left corner with a firefighter. Well, he's instrumented from head to toe, and we're giving him feedback about his muscle activity, his motion while he's doing this. And we are exhibiting, say, down in the bottom left-hand corner, different vibration devices where if people bend their backs, they'll get a little vibration to tell them that they're getting too far, all the way from exercise strategies. Then what we do is we do really kind of, at this point, very sophisticated lab-based testing where we're exposing people to these training interventions and then testing, does this transfer to non-training like activities? So does this show up when we're doing things on the job in these simulated tasks? And for this, we use really advanced biomechanical analysis. So the most exciting, and I would say first, one of the most promising things, but also quite exciting to us given our research interests, but is the potential effect that exercise is one of the strategies that we have, and really blending those other principles, but exercise as a tool to really modify behavior. Now, if we think of exercise in the more traditional sense, we think of things like making people stronger, faster, making their bones and tissue stronger. And those are all things that can happen with appropriately designed exercise for sure. But I think what we think has been really underappreciated and underexploited as a result is that exercise is a really rich environment to change how people, just basically to change their movement habits. Okay, but what that really requires is a much different approach to exercise. Okay, so a lot of when we coach exercise now, it's, do it this way, turn your hips, whatever it is. But with the focus in that is perceived as people is, I want to get good at exercising. Whereas we take an approach that we use different types of instructional feedbacks, different types of demonstration, different exercises and exercise progression to, for lack of a better term, decontextualize the exercise. So what we're trying to do is change just how people habitually move their bodies, so their preferences and their habits. And to do that requires assessment, right? If we notice a part of their body, say like their ankle that can't bend, that's something we need to address in training, but just addressing it doesn't necessarily mean it will show up either. Part of it is really using exercise as that environment. So I could speak all day about this, and I'd love to, for those of you who would like to hear about it, but that's just a slight difference. So just to show you one example of the efficacy of this, so we've tested this in firefighters. We've done a fairly large-scale intervention study. And what we did was we had the colored bars here represent firefighters who took part in this different style of training that we're promoting, which is still fitness, still gives all the benefits of fitness. We're still training people, but we're training them a bit differently. And in the red bar is a typical fitness approach where we're just trying to make people stronger, faster, all those types of things. Then we had a control group. And we've operationalized this just for this graph, that anything above the axis is a positive effect. Okay, so this was more spinal control, less spinal bending. And you can see just performing these lifts on the circled here are 4 different types of lifts that they did that they didn't rehearse in training. And what we saw was a really strong transfer of training effect in that group relative to the other groups who didn't participate in that type of intervention. So it's very strong evidence that we really can change, even in a short term, how people tend to move their bodies. We saw this in many tasks. I'm not going to highlight it here again too much, but the same points come home. Movements to behavior requires this multi-dimensional approach. I'm sure you've heard lots of evidence about lots of ideas about how spines work, and I wanted to kind of expand our thinking about that a little bit. And we have demonstrated that we can achieve positive transfer. So I'm not convinced that training, or we're not convinced at this point, that training is a lost cause. I don't think necessarily we have studied it as strongly as we could have. Finally, a big part of what we do is really to bridge the research practice gap. So all of this work that we've been doing so far has showed up in this peer fitness trainer program that's now used in more than 500 departments that represented across North America. We've had more than 700 firefighters take this. This is really just a peer training, train the trainer type of program. We have had lots of collaboration with the big unions in the United States and North America in general, sort of the international unions, and then many different fire departments as well. And one reason when I was asked to speak here, I was very excited because we haven't had an opportunity yet to talk to the different paramedic groups. And of course, what we've learned, working from everywhere from Olympians to soldiers, is that every work environment absolutely has their own constraints and issues, but we feel that a lot of these principles are really quite generalizable. And then, working with groups, we can really understand the perceived barriers and the real barriers to try to develop really implementable solutions. So we've had a lot of partners, but I do want to take this opportunity, especially in this environment, to thank the CRE-MSD because they've been funding this basically since day one in different projects. So I appreciate the opportunity to kind of speak on that a little bit, and thanks for your attention.